I started this project in response to the first wave of COVID. COVID affected my family in a way that was unique, although many families are affected. My mom's a double lung transplant recipient from Toronto General Hospital who saved her life. My brother's an anesthesiologist and my sister-in-law is a nurse. And my grandfather passed during the first wave of COVID and I wasn't able to see him. So all of these factors combined, I wanted to create a solution that solved issues that were impacting families across Ontario, Canada, and the world. We fundamentally understood that COVID was affecting the healthcare system, both on the long-term care side and the hospital side. And we understood one of the big issues was capacity. So if there was COVID patients in the hospital, immunosuppressed patients or cancer patients were at risk, so surgeries were being canceled, transplant was being shut down, beds had to be reallocated. On the long-term care side, if a resident tested positive, there were outbreaks at the home and there was nowhere to transport residents. So we wanted to create space, and not just beds in a box, but space that could save lives for people who were otherwise at risk.
And we've come up with and developed a mobile medical module designed to replicate a hospital condition. Uses heavily modified sea containers, and we convert them using the latest in technologies, aluminum panels with rock-sole insulation, high gloss paints. The electrical is all steel conduit. Tremendous amount of engineering went into the air handling system that we have. A lot of it was proprietary to the way we had to design it to fit in the smallest amount of space.
Each room has an individual HVAC system, so there's no cross-contamination of air between rooms. Our scalability is also a strength in that we can scale on a bed-by-bed basis. A lot of existing modular solutions or tent solutions are a fixed bed capacity, so 100 regular beds as an example, whereas we can do 5 ICU beds, 2 ORs, 3 patient rooms. Doesn't matter, we can do any number of them, almost unlimited.
These come very much plug and play. Everything that's inside our units are already built. It's designed, built, they slide in together, they clip together, and then they power one another.
This solution to mobile medical care is exceptionally cost effective because it uses existing technology in an innovative way. The basis of this is taking a shipping crate, which is extremely durable, and then adapting that to a medical solution, and it works. And it's cheap.
The idea was that these were designed, engineered, and manufactured in Canada, so a very Canadian solution to a very big problem in terms of having an ability to rapidly expand both urban and remote setting capacity for intensive care units, and also going a level above by being able to make these units negative pressure, which means that if you have deployed certain units as operating rooms, as an example, because you've got a mass casualty event, but after you've gone through all your surgeries and you actually need intensive care units that are negative pressure to care for those patients who have survived those operations, you just turn the switch and all of a sudden you've got a negative pressure ICU room. There's no other solution that has that kind of flexibility on the ground to actually adjust to changing needs.
So it's a very flexible way of creating what could be an entire hospital outside a hospital, both an intensive care unit, an isolation unit, a long-term care facility unit if you wanted, and an operating space.
We've also paid a lot of attention to ensure that the team and the patient, if they're able to, are still able to maintain that communication that is so vitally important with family and friends who may not be able to visit during a pandemic time.
So we designed a number of systems around patient and doctor communication with family. So we created a high definition audio and video system where nurses from the nursing station could see and communicate with patients at all times, where doctors could communicate with patient families, and where the patients could communicate with patient families. We also created large windows in one of our models with transition privacy glass, so family could come visit from the outside of the unit, even a COVID positive patient.
So compared to a traditional hospital facility, as a doctor, I feel that this facility provides us with everything that we need.
Is there anything lacking in this design construction? No, I want one.